Good morning and good afternoon or good evening to all of you who have joined us for today's session. My name is Dr. Amref. I'm a Senior Research Fellow at the University of Ghana. It's an honor and pleasure to invite you and to welcome you to this historic session that we're having today on Africa Leads the Way, a Compact for a 21st Century Health Workforce. We are very grateful that you have taken this time to join us for this session. A warm welcome to all our panelists who have years and years of experience and have worked within this sector for such a long time. It's our pleasure to welcome you to this program. The new public health order, I need to emphasize, calls for investment in public health workforce and leadership programs. Since 23rd of November 2021, the AU COVID Commission, which has been supporting President Cyril Ramaphosa's role as an AU champion on COVID-19, convened a stakeholder workshop. And in this session, there was a need to look critically at the health workforce for Africa. And having processed from that, we know that so many of our stakeholders continue to call for very critical look at the health workforce in Africa. And we know also that the Africa CDC framework for health workforce development has also galvanized a lot of social support among member states. So to start with, I would like to call on Dr. John Nkenga, who is the director of the Africa CDC and also the deputy chair of the AU COVID Commission, to expand a little bit more on what the workforce, the Africa Health Workforce is about and how the Africa CDC is championing this across our member states. Dr. John Nkenga, the floor is yours.
Thank you, Dr. Feni, and greetings to all the colleagues on this call, and good to see friends, colleagues participating on this specific panel. Let me say that perhaps the most important lesson that I have learned during this pandemic, the COVID-19 pandemic, is the critical role of workforce in responding to any pandemic or any endemic diseases. And this is not new. I mean, it must be stated that all of us who are on this call have dealt with the HIV pandemic. We've dealt with other endemic diseases, i.e. tuberculosis, malaria, non-communicable diseases. And the underpinning of all of this is always the need to have a competent base workforce, a workforce that is not only in quantity, but also has quality embedded in it for the continent. So I'm so delighted, as some of my colleagues on this call, Dr. Mahaz and Dr. Gitai, that we were called on by President Ramaphosa in his capacity as the COVID champion for the African Union to be part of the COVID Commission for Africa. And it is perhaps one of the most instrumental forum that has emerged during this pandemic to guide us as to how do we build back better, and focusing on several aspects, including workforce development. So in that light, during the summit, the African Union Assembly of Head of States that took place on the 5th of February, His Excellency President Ramaphosa presented a very comprehensive report to his peers, the other 55 head of states and governments. And in that report, he made a very precise recommendations. One of those was the need for Africa to establish a workforce task team that would define with clarity and we target what the needs are for the continent and what we must do to develop the right partnerships to get us to where we need to be. In other discussions, we have been very clear as Africa CDC that a continent of 1.3 billion people cannot be prepared to respond to pandemics with about 1,800 or 1,900 epidemiologists, just using the epidemiologists as one of the cadres of the workforce there. When the Global Health Security Agenda was launched several years ago, it was calculated and agreed that at that point, that you need one epidemiologist per 200,000 population. So if you divide that and assume the population of the continent to be 1.2 billion people, then of course becomes obvious that the continent of Africa needs about 6,000 epidemiologists alone, just to use that as, for the sake of this conversation to guide it. And so we currently have 1,800. We need 6,000, so the gap is very clear to everyone. So my hope is that we use the same metrics to look at the whole spectrum of what the workforce development for the continent will look like and must look like, and provide specific targets along the whole entire spectrum of workforce with respect to what is required for midwives, nurses, doctors, and of course, public health informatics, as well as laboratory experts, so that when we look at and begin to engage partners, both bilateral and multilateral, it becomes a playbook where everybody can open up to that and see exactly what the target is that we want to achieve. There's a saying in public health that what gets measured gets done. And I'm really hoping that this conversation will be the beginning of framing that direction, so that we are not, we truly learn lessons and not just document lessons. I always submit that we documented a lot of lessons during the Ebola outbreak in West Africa in 2014 and 2016. If you Google reports that were produced during that period, there were numerous reports from very respected institutions documenting what was needed. But we really didn't learn anything, because I don't know that anything was done later to bridge those gaps. I really want to hope that the COVID Commission chaired by President Ramaphosa, and of which this meeting is taking place as part of those directives from the presidency of that commission, will actually define this for the continent. We believe strongly that the continent needs to embrace a new public health order, and perhaps the whole world needs to embrace a new public health order that speaks to the fact that we will need to strengthen national and local and regional institutions, including structures like the African Medicine Agency, AMA, that we need to have our own, meaning that each country having their own response unit, what you call the mini CDCs or the National Public Health Institutes of the world, that is so vital to responding to diseases. We believe that as part of the new public health order, we need to have strengthened capacity for manufacturing of vaccines, diagnostics, and pharmaceutical, and of course, developing appropriate partnerships with the private sector. If you look at all the ingredients that characterize what we are championing, and the head of states are championing the new public health order, what is defining and underpinning to all of that is a competent workforce. Without a competent workforce, we cannot do research and development that would lead to innovations of technology required from the continent to produce vaccines, even advance the agenda for diagnostics, and as well as pharmaceutical. We should actually be saying that it is very appropriate to talk about the waiver in the intellectual property and technology transfer, but it's even more appropriate to talk about co-creation of these new elements, or the elements required to protect the continent against pandemics, which are called health security commodities. Health security commodities include personal protective equipment, diagnostics, pharmaceutical, and vaccines. You need a competent workforce to be able to do that, and actually hubs that can do that. So my hope is that when we get back to the president, and we'll be briefing the president, or the whole commission will be meeting again in the coming days, that we are going back to the full commission with clarity of thoughts, with a unity of purpose that says that we want to learn lessons from this pandemic, that we really want to produce a roadmap on what the continent should do, and then produce a compact that says that we are determined to work with partners, work with bilaterals, multilaterals, and other foundations to address the gap, the critical gap of workforce development, which I've always argued that it is the centrality of any health system strengthening. So I truly look forward to a very productive conversation. I also look forward to a conversation that we can actually begin to be champions of workforce development on the continent, and not just in one cadre, but across the entire spectrum. Thank you so much, and I look forward to stay tuned and continue to participate in this conversation.
Thank you so much, Dr. Nkengeso, and thank you so much for framing this discussion. At this moment, I'd like to go quickly to Dr. Gitinji Gitahi, who is the CEO of Amref and the lead of the Africa Recovery Work Group on this AU COVID-19 Commission. Dr. Gitahi, I want you to critically look at some of the dimensions that we've talked about when it comes to Africa recovery. We have talked about the social, the economic, the political, and also the moral imperative on us to really establish a fit-for-purpose health workforce. What are your thoughts about these? What are the stakeholders talking to you about? What are the key issues that you can raise when we discuss looking at how we can get this off the road, building clarity in our strategies going forward? Thanks.
Thanks, Amma, and I've listened keenly to what my brother John has shared about, of course, the political environment and need for this shift. And as part of the commission, and specifically the working group that I lead, which is the Africa Recovery, we did define Africa's recovery clearly as social, economic, and political development or recovery that is built on the foundation of healthy communities and healthy individuals. And of course, that means that health systems, universal health coverage are critical. But then, as has been reflected on, we do realize that for you to achieve these gains, you need a strong and equitable and accessible health system. But that health system is based on a foundation of a strong health workforce. We know, even in terms of financing terms, the health workforce takes one of the biggest chunks of the investment that go into the health system. But we also know that Africa has been shortchanged in terms of the availability and optimization of health workers. So we know that we are not starting from a good place. So last year, when the working group met, and we thought that it is critical that the future of the recovery of the continent and building back better is going to be dependent on a strong health workforce that then is the foundation for social and economic development. We called stakeholders somewhere around November last year. I think it was 23rd of November last year. And we got stakeholders from across the board. We had clinicians, we had frontline health workers, we had organized industry, including traditional practitioners who are relevant cadre of health workers across the continent. We had the investors and donor community, business, we had labor movement, civil society, we had academia. And within this consultation, which was very well attended and the discussions were extremely robust, there were several things that emerged. Firstly, there was a strong call for the region to consider itself as a producer of quality health workforce. And this workforce we are talking about is a 21st century workforce that is purpose-built to be ready for global pandemic threats. As we've seen, they're only going to accelerate, as we've seen it now so far, what has been happening in the last 10 or so years, but also to be ready for the achievement of universal health coverage. So we consider that Africa needs to see itself as a producer of quality health workforce for the world, which will start with Africa first, satisfying itself and retaining its best trained health workforce, but also attracting people from other parts of the world, because there must be skill exchange. And thirdly, to ensure that even after we flush ourselves with enough health workforce, we can then supply the world. So we must see our health workforce as a need for the continent, a need for engagement and skills exchange globally, but also as a health workforce of the world, so that Africa is also producing for the world. So we must not be inward looking. We must look at the global needs of the health workforce. But there were main themes that we discussed at this stakeholder meeting. The first theme was the theme around how to ensure we provide for an understanding of what Africa's health workforce needs are for the 21st century. What kind of health workforce do you need for pandemic preparedness, for universal health coverage, for this kind of recovery we're talking about? The next area is that we know that the female workforce occupies more than 70% of the health workforce, and it's really the backbone of the health system. But even with these facts, the female workforce is underrepresented in the leadership, management, and governance of the health workforce. So the question was, how do we invest in the female workforce in the continent? Third was, how do we leverage private sector for investment, and especially ensuring digital technology becomes an enabler of an enabled workforce for the future, ensuring private sector plays its role in ensuring that the health workforce is enabled with the technology they need to do their work. So there was a big theme around engaging the private sector. And then, of course, that we can't do all this without measuring. John says that you only do what you measure, basically. So we are saying that we need to measure health work optimization. What are the future needs of the continent? What are the demographic shifts that are also going to make us shift the type and the mix of health workers we train? What is the actual mix of health workers and different cadres for the continent? Is it the same as Norway and Sweden, or is it actually contextualized to the continent? So we must measure this. And finally, we must measure what is the output we are getting from the health workforce and what is the return on investment. So within these things, it was very clear that we need to move forward and actually recommend the task, the Africa Union Health Workforce Task Team to ensure that the continent has a collective agenda that is going to address this issue. Of course, overarching these conversations, Amma, is the fact that there was a call for alignment across the continent. So this is not going to be just member state by member state, but there was a call for alignment, there was a call for coordination, there was a call for collaboration, so that we could deliver one solution to support member states and catalyze them into the ideals of the Africa Centers for Disease Control and Prevention new public health order. So this is what was discussed, and the stakeholders were clear. And then it was followed up with a commission recommendation to the president, and then the president taking that to the African Union, and then the African Union heads of government and heads of states making the groundbreaking decision to ensure that Africa has this Africa Health Workforce Task Team to move the agenda forward. Back to you, Aman. Thank you.
Thank you so much, Dr. Gitahi. This is a good overview of what we're going with as we progress with the Africa Health Workforce. I'd like to turn to Prof. Maha Rabat. Prof. Maha Rabat is a former Minister of Health in Egypt. She's also a professor of public health at the Cairo University in Egypt. She's also a member of the Africa Recovery Working Group of the AU COVID Commission. Prof, you're welcome. You've heard a lot from Dr. Nkengso and also Dr. Gitahi. We want to talk about the female workforce, not because you're female yourself, but because it's glaringly becoming a problem. 70% of global health workforce are women, are female. And yet, when it comes to leadership in the health workforce, it's woefully lacking female health workforce members. Please, what are your thoughts around this issue? Why are we not seeing these numbers growing and increasing as the years go, especially seeing what has happened with COVID-19 pandemic, and especially in Africa? What are your thoughts about this? How can we change this rhetoric around the female health workforce? Over to you.
Well, thank you very much, Dr. Fanny, for the introduction, and greetings to colleagues on the panel, and particularly for the issue of the health workforce and the women in the health workforce. we have to acknowledge that by now we are too aware of the health workforce dimensions, which have been underscored by the COVID-19 pandemic, the deficiencies, the challenges, the fault lines across countries all over the globe and in Africa. So there has been so much exploitation of the inequalities, the discrepancy, impacting health workers on the front lines, 70% of whom are women. So women make up like 70%, as you mentioned, of the global health workforce, but hold on the average like 25% only of leadership roles. So there is this gender gap in the leadership, which are mainly due to existing the power relations, the power imbalances, the processes and mechanisms in place that really create and foster pathways that adopts or pathways for inequalities and inequities and discrimination. So the women's unfair opportunities to hold and practice the leadership roles are also outcomes of intersecting sociocultural factors, not only those embedded in the health sectors themselves, but they mark the identity of the women in many parts of the world. So the gender biases in the health sector exist in several forms. One of them is the underrepresentation in leadership, but there are other gender biases as well, like the share in the payment share, the insecurity issues. So there are other malpresentation of the gender biases as well. And although we know that women are included in the health sector or the health workforce, yet their employment, their jobs, their roles are not properly measured or weighed in the way that they should be. So addressing the gender gaps in leadership sets the development agenda, and we have to acknowledge this. It leads to more empowered workforce, improved motivation, more effectiveness, more efficiency, this creative, positive working environment, and the super added role of all team members in the health workforce, the retention of female workers, strengthening of the health systems. It's all part of a parcel of issues that we need to look when we're talking about building the resilience and framing the roles of each and every one in the health workforce. So what we want to do now is to change our investment model. We need to promote the effectiveness and efficiency, but at the same time to achieve equity for all, for men and for women as well. But now we're talking about women because they are at a disadvantage, particularly when we're talking about the leadership role. So it's building our resilience for a fit for purpose health workforce. And this is the opportunity when we're talking about the fit for purpose health workforce, because now it is mandated to define the equity agenda as well, and the equity focus in addition to the other gender parity and the social inclusion factors. So we want to maximize now at this point and into the future to guarantee in a way that we're maximizing the women's participation, inclusiveness, engagement, and empowerment to institutionalize their leadership positions, and at the same time addressing the gender biases leading to the unfairness and the inequities. So to address these issues, we need to expand the leadership roles and positions, to develop social protection policies, ensure decent working conditions. We want to maximize the role of women in the health sector, because as we know that with the changing in the demographic, the epidemiological situation in Africa and all over the world, the women demand for women's inclusion is going to increase as well. So that is why we need to have this gender lens or gender focus on how to position women in the rightful way. So in the recovery and transformation, we need gender transformative policies. We need to overcome those gender imbalances to guarantee the fair representation at the top leadership, not only on the mid-level cadres. So this could be done, and this were some of the recommendations that came out from the sessions that were undertaken with stakeholders, that we need to target the investment into the leadership training, to create forums for women workers at all levels to give feedback to leadership, to ensure the inventions are relevant, and the interventions are relevant. We have to have systems to harness the power of highly skillful health workforce, and at the same time to create this competitive environment and upward mobility for women to advance their position and the role in the health workforce system as well. And it is very important to create the safe and the enabling working environment so women health workforce workers can protect their professionalism, to develop social support policies so that women's progression is not affected by the social issues, and they should feel protected from any of the risks that they could be subjected to. So what is really important now is to think of the women inclusion, the women leadership roles, and the roles in the decision-making process as part of the development agenda that is really important to build the resilience in the recovery period for the health systems and for the development and achievements of the development goals as we're heading forward. Thank you very much. Over to you.
Thank you so much. Thank you so much, Prof. Maha. Thank you so much for your insights on this. Definitely a lot to think about as we go forward with this health agenda for our health workforce. I'd like to go to our last but not the least of our panelists. And I'm referring to Dr. Kerry, Dr. Vanessa Kerry, who is the CEO of Seed Global Health. Kerry, you've worked a lot with our financiers. You have years of experience working with donors. I'd like to ask you, looking at this compact, looking at the coordination, everything that is required to make this work, what do you think we can do? How do you think we should start beginning to start the work that we're doing? What do you think the pitfalls could be, and how can we avoid them? If you can give us just a brief around these issues. Thanks.
It can absolutely help, elucidate that. I think that, the work that SEED has been doing has been partnering with governments on the ground and partners and donors and other health partners to really focus on building out a health workforce that can be responsive, can build resilience, and can be able to not only meet these moments like in COVID, but can fundamentally also help support protecting essential services. And we've seen this happen in COVID, that essential services have been disrupted across the board. And so it's not just the impact of COVID, for example, but it's the fact that a woman can't deliver safely at this moment, or vaccinations get disrupted. And the tail of disruption and death and suffering that happens in moments like this, because we have not invested in a robust, comprehensive, skilled, and well-resourced and protected workforce, it will last for a long time. And this is the opportunity that lays before us in this moment, is to come together behind this vision, behind this mandate that the African Union has brought forth, to really invest in a fit-for-purpose, comprehensive workforce that serves Africa but can be in service to the world. And the mandate to create a social compact is really a potent call to action that allows us, I think, to avoid some of these pitfalls that we've seen in the past. And it really brings together all stakeholders around a common vision. Countries, donors, health partners, and implementers alike can come behind this, because it will help set agenda as well as key goals and targets for progress in health workforce development that you heard the previous panelists speak about. And critically, what a compact can do is define specific and ambitious human resource needs for the continent, and to help frame and define what that looks like, as Dr. Nkengasong spoke about. And he spoke about the full workforce spectrum that we need to see, from the skilled health professionals to the community health workers, the public health specialists, and the epidemiologists. And as Dr. Katahi also spoke about, it's also, though, about training leadership in science, technology, drug and vaccine development, management, civil service, and also creates the ability for us to think comprehensively about how this workforce fits in to truly transforming health outcomes and that recovery path to economic and social well-being that we need to see. Because you could building capacity at the level of governments for a pathway to domestic financing, so that this can be a sustainable system and resilient system over time. A compact system can also consolidate and align large-scale and long-term investments and activities to support the training and retention of a well-distributed workforce. Because this kind of plan, this ambitious but deeply needed plan, is going to require significant investment that no single funder or donor is going to be able to do alone. And so what is feasible in this model is to leverage everybody's commitments around a central vision and plan that people can come together with transparency and shared kind of alignment about where we're trying to move that is really fundamentally continent and even country-led. Because there's been a growing understanding among governments, funders, and multilateral agencies that there's got to be a need for health system strengthening and workforce investment. We lost 180,000 health workers alone in COVID. That's an underestimate. And there's got to be a plan for replacing that. But that's on top of existing shortages that we've already seen that are most critical in places like the African continent, where at least 36 countries are facing critical shortages. So the compact framework can actually harmonize governments and partners towards a single vision that is jointly executed, help set timelines that are realistic, longer, and needed for results in this sector, and create accountability and results through that alignment of vision, resources, and ultimately dedicated measurement, which I will hopefully be able to talk about a little bit. But it's also going to create flexibility, right? Because there'll be a framework ideally that comes out of a compact, this shared vision, but then that can that can serve as a template for countries to then dive into their specific needs, to understand, and build the national investment cases that can respond to the existing infrastructure in the country, the technology and human resource needs, address the disease burdens that are specific, help set priorities, galvanize not only the external budgetary support, but the domestic budget allocations and domestic and external health policies that are needed to support the investments. It can offer a detailed understanding of the chief constraints that exist currently and and plans to surmount those constraints. And it can ultimately then help design the training and retention of the workforce by country, costing plans over lifetimes, and support the implementations of programs. And it provides, again, this ultimate system of accountability because it'll serve as an agreement among stakeholders, donors, funders, financiers, governments, implementing partners about what needs to be achieved and help outline the roles and commitments towards those goals. And that progress can be measured transparently. Really learning in real time about how this iterative investment and adjustment can improve efficiency, effectiveness, and equity. And it provides really, I think, a mechanism for establishing, probably this is one of the most important things, establishing and committing to a shared value system of the outcomes and ways that we seek to have progress. Because with this approach, we can prioritize gender equity, health worker protections and needs for vaccines for the continent, where only 25% of our health workers were vaccinated in November by the time the Omicron pandemic started or the Omicron wave started. We can create policies that have support fair market practice and social investment so we can think about the international labor market. And we can help set the agenda up front to support countries from where they are today and how to get there. It's ambitious. It will require historic upfront investment and investments in universal health coverage that are grounded in principles of access, quality, and financial protection. But without this type of plan, Africa and the world, frankly, will continue to lose in economic potential. There'll be growing inequality gaps, increasing numbers of lives lost. And so there's really an opportunity, I think, for this to be a transformative call to action and a African-led opportunity for all of us to come behind and to support that could be transformative and I think sets an agenda for the world to follow.
Thank you very much. Raises a lot of questions for us. And in fact, one key question to Dr. Nkengeto. This is Africa CDC's framework for health workforce, another bold step for our continent. Are we able to coordinate amongst all our member states? Can we guarantee shared values among our member states? Can we also guarantee that our member states will all buy into this great adventure, which requires a lot of investments? What's the plan? How do you see this panning out in months and years to come. Dr. Nkengeto.
No, thank you so much, Dr. Feni. Let me start with from a very provocative standpoint that we don't have a choice as a continent. Absolutely not. I'll come back to your question, but let me tell you a short experience, share a short experience with you. In April of 2020, when the continent, we saw COVID invading the continent slowly. You remember the first cases of COVID-19 was reported in Egypt on the 15th of February. And then the second cases were reported in Nigeria around the 28th of February. And then we saw a cascade and every other country started reporting cases there. And we were scrambling. Guess what we did? We saw how countries in West Africa, some of the countries in West Africa, like Niger, Burkina Faso, Mali, and even in Central Africa, Cameroon, were struggling to have epidemiologists that could do effective disease detective work. At that time, if you recall, we had an Ebola outbreak raging in North Kivu, and Africa CDC had about 65 responders in the. We went to the Peace and Security Council of the African Union and made a case that we needed help from the peace and that they should activate the clauses of that this was the peace and security threat and actually a national security threat for the continent. The Peace and Security Council of the AU, which is one of the strongest and highly placed organ of the AU, authorized us to hire a military plane. And remember this, I know memory is short. That's my fear with this pandemic is I forget what happened to us. That at that time, there were no airlines flying on the continent. Okay, none. So they authorized us to hire a military plane from Uganda and Cameroon, and we flew that military plane to Kinshasa to pick up 30 responders. Okay, 28 to be very specific. And the 28 responders we've removed them from North Kivu and brought them to Kinshasa. They were standing and waiting at the airport. A C-120 plane comes in, a military plane to pick them out and take them to West Africa to distribute them a little bit like 555 in each of the countries that were in need. We did the first attempt. We arrived there and the government of DRC said that some paperwork was not completed. We had a call from the Minister of Defense in Cameroon saying, well, we need our plane back in Yaoundé. And they said the plane was still stuck at the airport there. We had to bring it back to Yaoundé. Then the next 2 days, we went back. So the point of that story is that, and then we successfully, of course, lifted the 28 epidemiologists and distributed them a little bit. It was like a little bit of giving you a little bit of peanuts here and there and there. That was the only way we could actually mobilize epidemiologists there. Now, why is this relevant? A continent, as I keep repeating myself, of 1.2, 1.3 billion people cannot continue to prepare for to react and respond to outbreaks by that you allow one disease outbreak to suffer because you don't have enough disease detectives or responders to other parts of the world. You cannot, other part of the continent, we cannot. During this pandemic, we were able to, with support from the MasterCard Foundation, we're able to deploy 20,000 community healthcare workers, 20,000 community healthcare workers. And the countries are most appreciative, okay, of that particular effort, that the important role that the 20,000 community healthcare workers were able to assist. Again, memory is short. Remember, at the start of this pandemic, the strategy was simple: test, trace, and treat, right? the 3 T's that so we needed people in the field, community healthcare workers to track, to find people, their contacts, and bring them up to, and do the isolation and whatever. We had nothing. We were only using public health measures to fight that. I use those 2 examples to highlight the criticality of workforce for the discussion. And that's why I started off by saying that the continent has no choice. If we really want to learn lessons from this pandemic and prepare for the next pandemic, and also revamp our overall health system response using a workforce and develop a compact, we have to engage in this. And the coordination role of how what you mentioned, and Dr. Gitai, is exactly why Africa CDC was created. Africa CDC doesn't seek to control, but Africa CDC seeks to coordinate efforts across the continent as a mandate of the head of states. Okay, I think that we all have acknowledged that we have to graduate from the silo efforts that every partner, party, body comes to the continent to try to do their own things, and then say, okay, what is it that the African Union is doing? It's not Africa CDC's framework, it's the African Union's framework. That is 55 member states have endorsed that. So what we are looking forward to, partnerships that come and align and say, look, if the continent has already charted a vision and a direction for all of us to align without controlling you, but rather coordinating, because we know the power of coordination leads to effectiveness and efficiencies, then that is what we should be doing. And I think if we rally behind this cause, then we will gain a strong political traction. I have no doubt about that. Our political leadership of the continent is just waiting for us to define where we go from here. Nobody will ever forget the economic impact, the health impact, the developmental impact of what COVID has done on the continent and continues to do for the continent. The resources that will be mobilized and allocated to this cause are just a fraction of the loss, the economic loss that the continent and the world has witnessed. I think we should always put that in relative terms, that we do not wait. You don't dig your wells when you are thirsty. You dig your wells before you are thirsty, so that you can actually do something when if you are thirsty, you get your water. Let me just end by sharing a famous quote that I always enjoy sharing with people. It says, "Inaction breeds doubts and fear, and action breeds confidence and courage." I think we should actually begin to breed confidence and courage that we can achieve this goal, which is absolutely indispensable.
Thank you very much, Dr. Nkengato, for such brilliant words and courage from you. Definitely, you have our backing, and I'm sure our member states will support this fully. I'll go briefly to Prof. Rabat. I'd like to ask, yes, we need a lot of people to dig our wells before we get thirsty. So who are these people we should be looking at? Critically, where should we be directing our attention to get this off the ground? Thanks. And briefly, please.
Well, I think we have to bring everybody on board, because at this point we have to understand that no single agency and no single sector and no one stakeholder can implement the changes required to achieve this fit for purpose health workforce. So it's everybody on board, and it's the coordination that would bring in everybody, defining the roles and leveraging what is there on the ground to sustain and to reallocate the resources as we're moving ahead. So it's coordination, all stakeholders on board, and at the same time, all sectors. And the most important thing is the alignment of the shared responsibility as well of each and every country in the continent to the cause of this compact. Thank you.
Thank you very much, Prof. Maha Rabat. Again, you have emphasized the need to get everybody on board, but we cannot do this without measuring. What are we measuring? Dr. Kerry, I'm going to come to you and ask you, what can we measure? What have we left out in previous efforts? What do you think we should be measuring going forward? It's really important to track our successes. Dr. Nkengato has mentioned that we need to be able to document our progress. But many of the times we don't have indicators, or we don't even track these indicators. What can we do? One of the issues you've raised also are the long-term benefits of these investments. It will not take 10 years. It could probably start bearing fruit in 20 years. Can we wait that long? Should we be tracking it in incremental phases so that we continue to get encouraged to keep putting in more resources? What can we do? What are the answers, please?
I wish I had all the answers, but I certainly can lay out a little bit of what I think can and should happen. This is going to take years, and we shouldn't be daunted by that. We should be excited by it. And we should realize that If we don't do this now, we're going to be in the same place in 30 years that we are struggling against today. We are actually seeing, we're seeing negative returns on our investments in global health right now with the disruption of services. TB deaths are up for the first time in a decade. We are seeing rises in maternal mortality. So we have to commit to this kind of plan and ambition, and we can measure ourselves along the way. One of the most extraordinary things I think about this kind of centralized system together is that there's actually an ability to maximize economies and scale of data so that you can develop continent-wide metrics and roll up country-level metrics into actually large-scale learning and data that could really be compelling to defining an equity agenda. And you do measurement also not just of the outputs, the numbers we train, the numbers we retain, but you can be inclusive and have broad quantitative and qualitative measures across these countries and the continent. And it's an opportunity, I think, to redefine and report metrics that are contextually appropriate, which identify the full spectrum of challenges to expanding the health workforce, anything from funding to those finance policies that keep countries from being able to invest in their health workforce or social sector spending, and tracking those kinds of policies across time too. So we can really, we can measure the return on investment across a number of sectors. So I think there's really a few key dimensions that we can measure. We can certainly look at the fact that the current data for health workforce planning is in many cases outdated or incomplete. Local health needs, I think, need to be informing the numbers and types of health workers that are trained and employed in each country. We can look at markers of health worker efficiency and productivity, requiring, looking at the amount of financing coming in, looking at health worker outputs, including absenteeism, service delivery, patients reached. We can measure quality. We can look at data on equity and inclusion, both on the health workforce composition and distribution across the geographic regions can be reported. But what if we started reporting the number of women who actually get jobs, if they are paid equally? We can look at the way families rise up. We can create a whole well-being agenda by changing the metrics that we measure. We can look at workforce flows across continents, leaving the African continent, coming into the African continent. We can look at whether community health workers are paid and the formalization of the whole spectrum of the sector. And I think we can also look across sectors, right? The return on investment on economic gains, on social improvement, inclusion, as I mentioned, or even the security data that we could look at. I think there's a huge opportunity here to create peer accountability through this kind of measurement, but also, again, to redefine the values by which we should be investing and we should be targeting, because it's not just an economic bottom line. We're talking about human lives, and we are talking about fundamentally what our human sustainability looks like. And that's what we have the opportunity to do across multiple countries, across 1.3 billion people, and again, to help provide that database for the world.
So thank you very much, Dr. Kerry. This is a lot, but it's good to see the big picture as you painted, and also to see that we can start gradually and build a database. I will move straight to Dr. Gitahi, and as I move to him, I'll be asking our panelists to start giving us their last thoughts before we wrap up. We just have a few minutes to go. So Dr. Gitahi, I'd like to ask you, so we have the backing of the AU to implement this. You have spoken to our stakeholders, you know their thoughts. We want to succeed. What are your last words about success? How will success look like for the Africa Health Workforce? Thanks.
Yeah, thanks, Amma. It's very clear from all the speakers and from all the considerations here that we have our marching orders from the heads of state and heads of government in the continent. So the mandate is clear. It's not questionable. It's clear. The success of this initiative is going to be nested within the Africa Center for Disease Control and Prevention. So it is going to be, as many of the people here will know, and in our audience, the Africa Center for Disease Control and Prevention has recently been upgraded to an autonomous agency of the African Union. So it's going to have more voice, more power, more representation, and the heads of government and heads of state are going to be part of its governance. Now, this particular Africa Health Workforce Task Team is going to be nested within that independence and that autonomy, so it has a chance to breathe and survive. So the immediate next steps are, we are of course going to form a core team, a foundational team that's going to work to develop an investment case. Because even as you listen to all the things we're saying here, this is not in a member state or African Union doing it alone. So you need an investment case that people are going to then invest in, all the partners, all the stakeholders, all our partners and donors, and of course the member states themselves are going to put money into the operationalization of this. So we are looking forward to, once we have this investment case, we are going, of course, to socialize it, create an advocacy around it to ensure that everyone understands where we are and what we're investing in. But the most important compact, and the most important compact that will ensure success will be the compact with member states of the African Union. It is the compact of the member states through domestic resources, but also their own buy-in of the fact that we need a new public health order and a complete rethink of the health workforce for the 21st century. Thank you.
Thank you very much, Dr. Gitahi. And next steps look very bright indeed. Dr. Nkengaton, your last words, please. I know you have a lot to say.
I can agree more with what Dr. Gitahi just said and what Vanessa has said. We need a compact with the countries. We need a compact with the partners and bilateral and multilateral to really support and align behind this continental agenda. The day we've always been looking forward to is here today. An Africa that is coordinated, an Africa that has a direction we are following. I've always heard in public that, oh, if only Africa, we knew what the continent wanted. Now, here we are with a continent that is assertive, has a clarity of thoughts with quality embedded in it. And again, just to end, we should also be looking at ways that we can create programs like what Africa CDC had proposed a few months ago, that there should be a returnee program. We set up programs that Africans who are in the diaspora can come back and support the continent. We don't need to uproot them from wherever they are in London or Harvard or Atlanta and completely bring them back into the continent. But we can create in this workforce space a switch program where they come in for an extended period of time, devote their energy, contribute to workforce development, and then return to their natural ecosystems there. I think we should be very, very innovative in what we do. But I fully endorse what Dr. Gitahi and Vanessa have said.
Thank you very much, Dr. Nkengaton. I'd like to go to Prof. Maharabat, please. Your final words. Can you hear me, please? Prof.
I think you're on mute.
There's something wrong?
I think you're mute. Yes. Prof. Rabat, you're on mute.
Can you hear me now?
Yes, we can hear you now.
Okay, well, thank you very much. I don't think I have much to add to what has been just mentioned by colleagues, but this is an opportunity. And as Dr. John has just mentioned, we don't have another alternative but to embark on this road as much as it takes. But this is the starting point. And we have to bring and to harness all our efforts, our actions on the regional level, and to get it as a pathway to our need for the health security and for saving, to develop this fit for purpose health workforce. So thank you very much.
Thank you very much, Prof. Rabat. I'd like to go to
Seems the
moderator's link has frozen.
Dr. Gitahi, would you like to close this out? Oh, no, there she is.
Yes.
Dr. Kerry, if you can give us your last words before we wrap up.
Oh no, I was actually, you had frozen, so I was going to see if Dr. Gitahi had wanted to close this out, because I thought Dr. King was also frozen. So that's all.
Okay, that's fine. Okay, that's great. And would also like to say that we have all your questions and we will definitely answer them and put everything we put together today in the document to send to all our participants. So on behalf of myself and everyone else who has joined our panel, I'd like to say thank you so much for joining us for today's event. And I'm sure we are all looking forward to what the next steps will be. And it's definitely a bright and successful future for the health workforce in Africa. Thank you, everyone, for joining us. Thank you again.
Thank you.